If you're like most of us, the terms that apply to senior living options all blur together. What's the difference between an active adult community and a 55-plus community? Is a full-service retirement community the same as assisted living? Just what is a continuing care retirement community or a life plan community? And what's the difference between assisted living and long-term care? With us today to explain this is Carol Ann McCormick, Vice President of Sales and Marketing at Duncaster, a community in Bloomfield. She's also a Simsbury resident. She's worked in the field of senior housing for over 20 years. Welcome, Carol Ann.
Thank you.
So there's a lot here. Are there general categories that these options break down into?
Sure. There are really 5 different categories of senior housing. There's 55 plus,
Okay.
assisted living, independent/rental housing type communities. There are also skilled nursing centers, and then there are life plan communities. So a life plan community encompasses all the other components.
Okay. So let's start from the top. What is a 55-plus community?
55 plus, very common type community now. Most states have numerous locations of different 55 plus. They are a community intended for empty nesters who are typically still working out their career with no children at home, who want less homeowner responsibilities. So people who don't have as much time for mowing the lawn or fixing the roof. And typically your neighbors are going to be people like you, empty nesters in their 50s and 60s, going to work and having less chores upon returning home from work.
So if someone has a child that is living at home with them, say coming back from college, they can't live in that kind of a community?
They could probably, usually you can't live in that type of community. If your child is really away at school, they're not really living with you.
Right.
But most of them have an age floor of 55 plus.
Are there other terms for this kind of a community?
Active adult is something that we hear a lot.
Okay, I've heard that one.
Yes, so usually they're called active adult or 55 plus.
So you mentioned some of the advantages. What else is an advantage?
Definitely you have maybe camaraderie if you meet your neighbors, because you
Okay.
are in similar age range. Some of the communities will have recreational functions.
Okay.
Perhaps they have a golf course or tennis or a swimming pool.
Okay. And so when you're weighing this kind of option to figure out whether that's for you, what should you consider?
I think first and foremost, how long would it be reasonable for you to live there? If it's someplace and you're 55, well then probably live there for maybe 20 years.
Okay.
So you're going to, find some longevity then. I think you also want to consider, kind of location. What's it near? Obviously, you want it to be near where you work. You might, want it to be near different shopping, different, activities that you participate in. You also want to look and see if they have any other features or benefits. Maybe they don't have a tennis court or a swimming pool. Maybe they just do the snow blowing in the roof. But you really want to look and see what do they have to offer you, not just in the housing, but in the community itself.
Now, were they always condominiums or some of them rentals?
No, they're typically condos, freestanding houses, maybe with 0 lot line,
Okay.
and sometimes even in apartment buildings.
Okay. So then we move to independent or residential living. What is that?
Yeah. Independent and residential living in Connecticut can mean the same thing. It typically means a rental apartment home, and there's usually an age floor, 60, 65. There's some age limit that you have to be higher than or have attained to live there.
Okay.
And often there may be some services. They may be services like housekeeping or maintenance. They're definitely going to have services like snow removal and exterior maintenance.
Okay.
They might have recreational amenities, but they may not. And they typically do not have any sort of help or assistance with any type of health care. The same with the 55 plus.
Okay. What else? You said that it could be called independent or residential. Are there
Yes.
other terms for this?
You may hear abbreviations, IL,
Okay.
RL. I will caution, though, if people are looking in states other than Connecticut, residential living can have a different meaning, and can mean that you're someone that's receiving care.
So it varies by state, this term?
Correct. Mm-hmm.
Okay. So what should you consider to see whether this is right for you?
You definitely want to look at finances. You want to consider your age as well. Is this a community that you could live at for 15 or 20 years? If you were to have some illness befall you 2 years from now or 3 years from now, what support systems does that community offer in their staffing for you?
Do they ever have relationships with other resources?
Mm-hmm. Yeah.
Like nursing
Typically,
homes?
most independent living communities are not going to have any type of health care on staff or as part of their agreement with you.
Okay.
But they may be able to give you listings of third-party providers that possibly will come and help you in place.
Then you go to the other extreme, which is assisted living. What's that?
Assisted living is for people who need care. I do caution people because many assisted livings do advertise themselves as retirement communities.
And they're not?
They're really for people who actually are already having trouble.
Okay.
Maybe it's physical, maybe frailty is setting in, maybe even forgetfulness, judgment challenges. So assisted livings are typically a setting where most, if not all, of your meals are going to be prepared for you because either you can't or you're maybe not safe to do it anymore.
Okay.
There are typically nurses' aide staff on duty, and typically there's going to be a nurse's aide there around the clock, not a nurse. Most people who are living in assisted living are going to have some level of forgetfulness.
Okay.
Even if it's an assisted living that is not a memory care assisted living, you will see, the majority of people living there will have forgetfulness. Others may be there for frailty reasons.
And are there other terms for this one?
Yes. Connecticut, we really do call them all assisted living. You may also hear a term or an acronym AL. Mm-hmm. If you go to other states, you may hear residential living as a term. You may hear
And that means the same thing in another state?
It can, depending state to state. You may hear the term enriched living or enhanced living. Those can also connotate assisted living, or they can connotate memory care. So you really want to learn how it's defined in the state that you're searching.
So what are the advantages of assisted living?
They're a very good stopgap measure for somebody who's no longer independent. Maybe they would not do well at a 55 plus because they really can't manage their own life safely anymore. And by the same measure, they are not healthful enough for independent living or living at a retirement community. So independent living is a good in-between stopgap for someone who's not independent but does not yet need skilled nursing care.
That's our next category. What's the difference between that and skilled nursing?
Okay. Assisted living, you're getting help with your activities of daily living, and it's really a non-medical type of health. So the people helping you are going to be nurses' aides or housekeepers, cooks, recreation therapists. Skilled nursing, you will have all the help with activities of daily living, and there will be aides, and there will be recreation therapists, and there will be housekeeping and cooking staff, but there will also be nurses, and there's medical oversight. So there's a point where you need medical oversight. Maybe you have diabetes and you need your blood checked every day and you can no longer get around on your own. Then you may be above the capacity for an assisted living to legally take care of you in Connecticut because there are regulations. So you may need skilled nursing type care.
Is that also called a nursing home? Is that what
Nursing
we think of
home,
as?
nursing center, rehab center, SNF. The names are skilled nursing.
Oh, okay.
Yes. So there are all kinds of names and acronyms. They are regulated nationwide, so you will find the same terms used in each and every state.
Okay. And how do you find a good one?
You can go on Medicare.gov. They do ratings. You have to be cautious because the average layperson doesn't really know how to understand the rules of skilled nursing. Nobody ever would like to find themselves using a skilled nursing center But the truth of the matter is many of us will. Some of us short-term, maybe for a knee replacement.
Oh, okay, that might, so it might be short-term.
Yeah,
But most
might be.
people in the skilled nursing facilities are longer-term?
Yes. And another good way, if time is on your side, you, or probably not you, but somebody who's searching for a skilled nursing center for you may want to visit one or two, because you're going to get a sense. Do you see people being cared for, or do you get a sense that people are left to their own devices and bored 12, 15 hours a day?
Okay.
You know, what does it seem like a clean environment? You know, use your five senses when you're visiting.
And what's the advantage of when you get to this point that you need it? What's the advantage
Well,
of it?
skilled nursing is less cost-effective than bringing care into your house. Otherwise, skilled nursing centers would not exist.
Okay.
But you're getting care from nurses, from aides, you know, therapists if needed. Doctors do visit, you know, nursing centers, so you're probably seeing a doctor maybe every other month or so if you're in a skilled nursing center. You know, so safety is an important factor, and, you know, and it is more cost-effective to be able to provide safety to several people rather than individually in a house.
Now, are most of the facilities in a skilled nursing facility, are you in a room with somebody else?
Yes, yes. Nationwide, I believe only about 10% of all nursing center rooms are private. So I think, I think for the most part, Connecticut probably falls in line with that. So the majority of time, if you're at a nursing center, you probably will have a roommate. Maybe two or maybe three.
Really?
Yeah. But most commonly is a roommate. So at a time in your life where you're either sick because you're out of the hospital and want to recuperate, or you're perhaps spending your last year or two, you know, in a nursing home for ongoing care for progressive health troubles that you're having, times when you want privacy and dignity, you may not have them.
And are these all covered by Medicaid or Medicare?
Medicare is a whole nother probably conversation. Medicare has very limited benefit for people for skilled nursing. It's not a long-term care payer source. So it does not cover any long-term care. It does cover short-term rehab type stays, but there are also qualifiers on top of that for up to 100 days in a year. And Medicaid, on the other hand, is different from Medicare in that it is a type of healthcare welfare. So if somebody has outlived, I shouldn't say outlived, if somebody does not have income, they may be utilizing the welfare system to help with an income stream. Likewise, Medicaid is a healthcare stream for people who do not have healthcare insurance of their own, or who have very limited financial resources to pay for healthcare.
So when you're thinking of whether this, you know, which one is right for you, what should you consider?
For a skilled nursing center, again, you want to walk in. You could do some online research on Medicare.gov. You may, if you have an opportunity, definitely make a point to talk to the administrator or the director of nursing at the community to get a sense for the culture that they have with, you know, between their caregivers and the residents. You may even talk to a few of the residents, but you want to make sure you're talking to someone who's staying there who's not there for a cognitive reason.
Okay. And you mentioned that sort of a life plan community brings some of the advantages of this all together. Talk about what that is.
Correct. Life plan communities are a few and far between. They're not in every town like you may find assisted living or skilled nursing. They're not as prolific as 55-plus communities. But every state in the U.S. has life plan communities. So Duncaster is an example. And a life plan community takes the components of all of the different categories like we've just talked about and woven them into one. So they typically have an age floor. You're typically able to avoid a lot of the burdensome type chores that you may not wish to have forever as a homeowner. That bring together the fact that you would move there when you're healthy. In fact, life plan communities in the past were referred to as retirement communities, but it really wasn't accurate because you didn't have to be retired to live at the community.
So are there people at Duncaster who work?
Sure, yes. And I'm sure every life plan community in the U.S. probably has some people that still work, and many that probably even give more through volunteering, maybe even more hours than they did in their career. So the life plan communities, generally speaking, not always, but generally the majority of the community is for people who are still independent, managing their household, enjoying a good life. I guess the comforting factor about a life plan community is if you have a health change, you don't have to worry about where will I go next or what if, and your children won't have to worry about that either. So in a life plan community, if you have a health change, a life plan community cannot be a life plan community if it does not have, at a minimum, independent living and skilled nursing. Okay.
So were those right there, or is it a
They're-
relationship? How does that
They're
work?
right there. So as part of a life plan community, written into your agreement with them, is the fact that there is skilled nursing there for you. May also have assisted living, like Duncaster does, may have memory care. They may have inpatient or outpatient rehab too, but a life plan community is a place where when you reside there, if you have a health change, you don't have to worry about where do I go next, who do I turn to for help, because everything is programmatically right there with staff that will help you, your spouse, your family if they're involved with you, into a stage of care if you end up needing care later.
Well, so if I go into one of these communities with my husband, and my husband needs to go into this skilled nursing facility, what happens to me?
Well, just like you're in your house right now, if your husband needed to go to a skilled nursing center, he may go to skilled nursing and receive rehab and come back home. Okay, you don't know where that rehab center will be. It might be 5 miles from your house, 10 miles from your house, or on the other side of town.
Right.
But if you and Ron are at Duncaster and he needed to have some sort of surgery or any hospital stay, then he would come back to the skilled nursing center at Duncaster. Instead of getting in your car to go see how his rehab is going, you could walk right there on campus.
So at Duncaster and in all these communities, the skilled nursing facility is right there.
Skilled nursing is there. Most of life plan communities will have rehab as well, but they don't necessarily have to. But they will all have long-term skilled nursing. So if you or Ron ever needed permanent, ongoing care in a skilled nursing setting, it would be right there.
And I get to stay in my house, if it's just him.
Yes.
Okay. And so when you're thinking about this, what are the things to consider? That's a big move. So what are the things to consider?
It's a huge move, and I think it's the biggest move that people make ever in their life. It's the biggest decision, really. It's more than just a move. First, you want to feel like it's a good fit for you. Once you feel like, okay, do I feel like I might want to live here? Then you want to investigate a little more deeply. You want to look at their ratings on the health care they provide. You want to look on the financial status of the community. You're going to want to find out if they're a for-profit or a non-profit. Do they have a board of directors, or is there a corporate entity, hospital, religious organization who's running the show?
Okay.
Because that's important to you because you're going to be living there.
So this is pretty overwhelming.
Yes.
How do I decide what the best choice is for me when I get to that point?
Well, if you want to better understand all the terms, and we haven't even really touched the tip of the iceberg. There's a lot of terms, a lot of acronyms, but there's an ebook on the Duncaster website. So you go to duncaster.org, and you can then download an ebook that actually goes more in depth than this. So you can have things printed out, bullet points, to help you better understand whether you're looking here in Connecticut or elsewhere.
And that's available on the Duncaster website?
It is.
And it's free?
It's free, yes.
Excellent.
Yeah.
Well, thank you very much. This has been very helpful. It's a very confusing topic, and I appreciate you taking the time.
Thank you.
We have been talking a little bit about the alphabet soup that is senior housing, and I thank you for joining us.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.